You having some numbness in your hand, your first couple fingers at night? Pain also in these fingers, particularly shaking hands, opening a doorknob, screwing, hammering something. These may be signs that you have carpal tunnel. So stay tuned and we'll talk to you a little bit about what is carpal tunnel and some things that you can do to try to help. So what is carpal tunnel? Well, carpal are the bones of the wrist. And with your hand like this, they form a little tunnel where that nerve goes through. And it is the most common nerve entrapment within the body. Ladies it's more common in women than it is in men by 3-to-1 ratio. Generally happens between the ages of 45 and 60, so it takes a little while for it to develop. But they don't notice this as much in third world countries as they do in industrialized countries, and they think it's our habits and our repetitive motions that seem to aggravate this. Keyboards, cell phones, assembly line type work. That seems to really aggravate this thing more than anything. What happens is you'll get numbness in these first 2 fingers and the thumb, and pain. It generally starts at night when you're sleeping, and during the then you can get it a little bit worse during the day where it starts to hurt and go numb on you. There are 5 criteria for conservative care for the carpal tunnel. Now, we can help carpal tunnel a lot if you get to us early. If you wait too long, then chances of us helping are slim, and you're probably going to end up with surgery on it. So here's the 5 criteria where we can help with a lot of this stuff. So number 1, age over 50, duration greater than 10 years, constant numbness in that hand. You've got some what's called tenosynovitis, or you've got some inflammation of the tendon of the thumb, and then positive Phelan's test under 30 seconds. So Phelan's test is you hold your wrist like this for 60 seconds to see if that makes it go numb. That's an orthopedic test for carpal tunnel syndrome. You can do that at home, and if it reproduces those numb or pain in there, most likely you do have carpal tunnel. However, though, if you only have 2 out of those 5, there's an 83% success rate with conservative care. If you have 3 out of those 5, there is a 7% success rate with conservative care. If you have every one of those things, there is a 0% chance of helping with conservative care. So again, getting here as quickly as possible when you start getting this nighttime numbness in these fingers like that enables us to help this a great deal. So if you hang on just a minute, I'll show you some stretches that you can do at home and what would we do to try to help this condition. So what are some stretches that you can do for carpal tunnel? The first stretch is kind of easy. If it's your right hand, you take your right hand out, take your left hand and pull this back. You should feel it stretch up and through here. That's going to stretch and open up that carpal tunnel area in through there too. Hold that 10-15 seconds, relax. 10-15 seconds, relax. Do that 3 or 4 times. The other one is another nerve stretch. And again, if it's your right hand, you're going to start with your head tilted away, hand on your shoulder here, and then this motion of coming back and out like that. Back and out with your arm and your hand. Do that maybe 15 times or so. Those are 2 really good stretches to try to open up this space in there with the carpal tunnel. If you don't have all 5 of those things that I mentioned earlier, you want to try conservative care on this. Well, what do? Well, number 1, we're going to have you get a brace on there. Number 2, we can do some taping on it. We do some soft tissue work on the forearm in through here to see if that can loosen some things up. And then we do manipulation of the wrist. Does not hurt. Again, the goal of trying to open up that space in there where that carpal tunnel, where that nerve comes through the carpal tunnel there. So if you're having carpal tunnel issues, you'd like us to take a look at it, please give us a call at 512-556-8223. I'm Dr. Craig Benton at Benton Chiropractic Clinic here in Lampasas. Thank you.